This is my dog, Ethel. As you can see, she's very calm and sweet. We rescued Ethel from the pound. Would you believe that her previous owner sent her to the pound because she barked too much and was unruly? But you see, Ethel's previous owners did a foolish thing. Ethel was going blind, and she was becoming very anxious, and therefore she would bark. So what her previous owners did was give her a treat which would make her start eating and stop barking. But you see, dogs are the same as human beings who are the same as healthcare professionals. We reap what we incentivize. In dentistry, we incentivize intervention and volume with little consideration for patient satisfaction and outcome. Therefore, we are more likely to drill, fill, and bill than prevent, monitor, or observe. Here is a paper that we published that suggests fee-for-service is actually making it harder for patients with special healthcare needs to find a dentist. The reason is, patients with special needs might be more complex and take more time to deliver the same procedure as a healthy patient. The problem with this is the dentist is reimbursed the same. The dentist is reimbursed only on fee for service. There's no inclusion of complexity. What if dentistry went to a whole new method of reimbursement that involved incentives for patient satisfaction and bundles that incentivize outcome? We require this of our physicians, and yet not our dentists. If we continue in this fashion, dentistry risks being excluded from the professions. The Bureau of Labour Statistics defines a labourer as someone who performs a manual task, and that's all we're doing if we're incentivized to drill, fill, and bill. A good dentist is supposed to think. A good dentist is supposed to customize care for their patient, taking into consideration individual risk factors, systemic disease, oral disease of course, manual dexterity, diet, environment, social support at home, and various other complex factors. Drilling and filling. Is this what our profession is going to be in the new millennium? I hope not.